Welcome to the Simple Questions Podcast. This is your host, Dylan Carnahan. The question for this episode is, what is dermatology? You will learn in this episode the most common skin issues people experience, what is most misunderstood about skincare, and practical ways anyone can improve their skincare routine. Our guest has published numerous dermatology articles and serves as a reviewer for the Journal of the American Academy of Dermatology. Trained at top institutions nationwide and specializes in medical, surgical, and cosmetic dermatology. And is the medical director and founder of Kaminska Dermatology in Chicago. I introduce to you Dr. Edidiong Kaminska. I am 14 years old, looking into the mirror when I am fixated on my acne. This is something that wouldn't go away. There would be many things I would try, and it would eventually get to the point where, after several conversations with my mom, I would get a dermatology appointment. That was my first introduction to dermatology and skincare. I wasn't the most preventative, but that was kind of my initial journey and initial exposure. So, Dr. K, I want to ask you, how did you first get exposed to dermatology?
I have a similar story. So when I was a teenager, I had this acne that was not going away. And commonly in skin of color, when you have inflammatory acne, it can leave dark spots. So even when the acne resolves, you can be left with a type of mark that it was there. And that can be more distressing than the acne itself. So I told my parents that I wanted to get my skin fixed, get my skin checked, get it clear. And I think they spoke with my pediatrician and they referred us to dermatology.
Okay.
So that was my true first exposure to skin in medicine, if that makes sense.
Mm-hmm.
So I went to the dermatologist. I remember the dermatologist prescribed me some pills. The pills made me very sick and we never went back. So I was a teenager too. But
Okay.
when I eventually went into medical school, when you go to medical school, you learn in the first 2 years in most schools, you'll learn the basics. So the science of embryology, immunology, pharmacology, you have this basics. Everyone learns the same thing for the first 2 years. And then the second 2 years, you go into your primary rotations, which usually include family medicine, general surgery, obstetrics and gynecology, pediatrics. And then you can choose electives. So, and those electives include things like dermatology, the specialties, plastic surgery, ophthalmology, anesthesiology, radiology. So, some of these things are electives. And in my school, people talked about how wonderful dermatology was. We had a very great, strong dermatology program at my school. And I didn't know what to go into because I didn't have any physicians in my family.
Mm-hmm.
So I came in with an open mind and I seemed to love all of my rotations just about. So when it came time to choose an elective, I chose dermatology and I fell in love with it. It was the perfect specialty for my personality, because you can do many things in dermatology. You can do surgical dermatology, you can do medical dermatology, which acne goes under the purview. You can do pathology, which is the study of skin. Well, it's specifically to dermatology. Dermatopathology is the study of skin underneath the microscope. You can do all kinds of things in dermatology. You can do rheum derm, which is rheumatology and dermatology combined. So you
Mm-hmm.
can do laser, you can focus on laser. So there are many different avenues that someone can do. A dermatologist can specialize on cosmetic dermatology, even. So, and also you have the broad range of patients. So you can see patients from when they're born until when they die. So you can see all ages. In internal medicine, you usually see patients 18 and up. In
Mm-hmm.
pediatrics, you usually see from birth to age 18. So in dermatology, depending on what you prefer, you can see the whole um, age gamut and you can take care of families. So you can have long-term family and patient relationships. Um, so that's how it started. I did the rotation. I fell in love with it, and then I had to work really hard to get in because dermatology is very difficult to get into.
Okay. No, I appreciate you sharing that story. I want to elaborate on this specific point. It's always interesting to hear how guests get, um, they pursue something, right? And you mentioned this aspect of personality and how this kind of clicked with that. Can you elaborate on how dermatology resonated with your personality? Is it just kind of the variance?
No, I mean, so dermatology, usually the appointments are short. It can be anywhere from 5 minutes up until 15 minutes. Usually most people don't do more than 15-minute appointments unless there's a complication. So in that time frame, you need to make a connection with the patient. You need to be very observant. A dermatologist uses their eyes to diagnose things. A lot of the times we can see, as dermatologists, we can see what the problem is without even speaking to the patient. A lot of times,
Mm.
because usually you can see the rash or the lesion on the skin. And it- I found that most patients in dermatology were very happy to see a dermatologist. They were happy to be there. Usually we can treat things and we can make it better, and patients can see the results fairly. It depends on the condition, but they can see the results. When something improves, they can see it.
Yeah.
For example, with a primary care doctor who's treating hypertension or high blood pressure, someone may not feel that there's anything wrong, and they might have to get started on the medicine and without ever feeling any symptoms, right? So they
Mm.
don't necessarily see the improvement. In dermatology, often patients see the improvement, and that's very gratifying for me and also for patients to see that their condition is getting better. Um, and also when I rotated there, this is a little controversial, but certain specialties have personality types associated with them,
Yeah.
and dermatologists are typically associated with happy people. There was an episode of Grey's Anatomy, if you know that show, where they had a segment where one of the surgical residents, went to the dermatology to interacted with the dermatology residents, and the dermatology residents were super happy. I would say in general that I am very happy. We work hard. We have to pay attention to the details. And that is the biggest thing, is paying attention to details, honing our skills, and improving our craft with we're detail oriented people, and I am a detail oriented person, so that was one way that this specialty resonated
Hmm.
with me as well. Outside of being happy and getting the gratification from treating patients and them physically seeing their improvement and I physically seeing their improvement, it's also paying attention to details, and it's almost like solving a mystery or a puzzle sometimes. You have to put the pieces together, you make the diagnosis, you give them the appropriate treatment, and they get better. And that's also very rewarding.
Yeah. No, I certainly can see that, and I appreciate bringing up like that visual feedback. That's something I wouldn't have thought of prior to this conversation. Um, when going back to these puzzles, could you, Dr. K, elaborate on what are some of these puzzles that you're presented with?
So some of the puzzles could be, so some things can present as a rash, but there can be systemic findings, or there could be something internally that's going on with the patient that needs a further workup. For example, when I talked about rheumatology and dermatology overlap, lupus, I don't know if you've heard of lupus, is an autoimmune disease where the body produces antibodies and attacks itself, and it can attack multiple organs, including the skin. And someone can come in with a skin rash, and I can look at them and say, "Oh, it looks like X, Y, and Z." But if I don't ask the appropriate questions, like if they have the symptoms and signs associated with lupus, are you having joint pains? Are you having sun sensitivity? Then I might diagnose the skin issue, but miss the overlying issue, and they may not get better unless you treat all of them. So that's an example of the solving a puzzle or figuring
Hmm.
out what else is going on. There's certain rashes too that present in a way that if you don't ask the right questions, you can miss the diagnosis. So, and another simple, not anything that's autoimmune rash is something called phytophotodermatitis.
Okay.
And this is the type of rash, if someone splashes, or if you have lemon juice or lime juice that splashes on your skin, you go out into the sun, it can create a rash. And that rash can, sometimes it may blister, sometimes it leaves dark spots. And over the years, I've seen patients that come in and they go, I got this rash. I don't know how this happened. I don't know what was going on. And I said, were you somewhere warm? Did you have any margaritas or were you working with limes? And they're like, yeah, I was. And then I explained what the rash is to them. They're like, their minds are blown. They're like, oh, how did you guess this? It's like, it has a classic look to it. You can miss it if you don't ask the right questions. I mean, there's several examples like this where if you're not asking the right questions, if you don't connect the pieces of the puzzle, you're not going to see the big picture and you may miss a diagnosis.
No, that's very important, Dr. K, because one of the things I'm thinking is from the patient education perspective that you go into your dermatologist and they begin asking you questions about, margaritas or, asking you certain like health questions that aren't related to your skin, right? That can be very puzzling for the patient. And so I greatly appreciate bringing up kind of the significance that can hold on the diagnostic process. Um, I would like to address too, um, acne. You and I both came in with kind of like a personal story relating to that. Could you, I guess, give us a little education on what acne is and how to treat it?
Sure. I mean, acne is an inflammatory condition of the hair follicle and oil producing glands. And we have little tiny hairs all over our bodies, obviously not on our palms or our soles, and not inside of our eye socket, but all over our bodies. And so a high concentration of those hair follicles and oil producing glands are on our face, chest, and back. Acne is multifactorial, meaning we don't know exactly why it happens in some people, but we do know that there's a genetic component sometimes for some patients. There can be a dietary trigger in some patients, and there can be a hormonal trigger in other patients, or it can happen just because. And when it happens, it can be distressing, right? Most people don't like having acne. They consider it a blemish, or they call it zits, right? And people want it clear because it can be emotionally and psychologically distressing. There are actually studies that show that acne can cause depression in some patients. Acne is also has many forms. There, there's acne that's whiteheads and blackheads. That's called comedonal acne. So it's usually not red, but the little whiteheads and blackheads. There's inflammatory acne or papulopustular acne with the red bumps and the red bumps with the whitehead attached to it. And then there's cystic acne, which are the ones underneath the skin pushing up. And those
Mm-hmm.
often can be painful. They can be itchy. It can be irritating. So the treatment depends on what kind of acne you have, what's the underlying trigger or cause. And if we can identify that, we can often treat the acne appropriately. Usually, with the mild form of acne, with the whiteheads and blackheads or comedonal acne, oftentimes that can be treated with topical prescription medicine. And one of the medicines that is very popular is a medicine in the family of retinoids. Retinoids are vitamin A derivatives. Some people have heard of it as, Differin or Retin A or Tazarac or retinols that are over the counter or in that category or in that family. And so oftentimes those medicines help to turn over skin cells, exfoliate the pores, kind of unclog those pores, um, and can smooth the skin. When you get into the red acne or the cystic acne, depending on the severity, sometimes we do oral medication by mouth. And so I mentioned in my story that when I saw the dermatologist, they gave me a medicine by mouth that made me very sick. And that medicine was in the family of antibiotics. It was in the tetracycline family. Antibiotics can help treat acne, not because acne is an infection, but it can help clear inflammation. So a lot of antibiotics have anti-inflammatory properties. They kind of
Mm-hmm.
calm the immune system down. They calm down things that are inflammatory like acne. And so that's another potential treatment. for acne.
Wow.
And then there's a medicine that has been around for many years. Brand name is called, the brand name most people know is Accutane. The generic name is isotretinoin, which is a type of retinoid. It's an oral retinoid in that vitamin A family. So retinoids are a derivative of vitamin A. And it is kind of a bazooka for acne, but it can work really, really well to clear acne that's not responding to traditional therapies
Hmm.
or acne that is severe.
Okay. Dr. K, I want to make a that was very helpful. I appreciate you walking through that. That was a very good introduction. In talking kind of these various different treatments, um, can you maybe delineate when is th- is this a and I know this is very general, but can we talk about the delineation between maybe skincare versus maybe receiving an oral or topical medication?
Right. So skincare, in terms of acne or just general skincare?
Just generally speaking.
Everyone has different skin types. So some people may be oily, people may be dry, some people may have normal skin, they're not oily or dry. Some people may be sensitive, some people may have hardy skin that can tolerate a lot of things. But basic general skincare includes usually washing your face with a gentle cleanser. Um, and if you want to do something a little bit more, some people like to tone, like use a toner to get the skin prepped and ready to absorb moisturizer, to absorb any type of active serums or creams that they want to use to improve their skin barrier, and sunscreen. So my top three, when I tell someone if they're just looking for a skincare routine, a gentle cleanser, a topical vitamin C, because vitamin C is an antioxidant, kind of helps with anti-aging of the skin, prevents oxidative damage from the environment, can help with hyperpigmentation or dark spots if people get dark spots, and sunscreen. Those are my like three go-to things for someone who wants a very simple regimen.
Oh,
But
that's
outside of that, a healthy diet, exercise, all those things play a role in the skin. The way I view our bodies are basically these large, complex machines. But if you put in good things into your body, if you take care of your body, it will take care of you for the most part. And that also reflects in your skin.
hmm
And I can even be a little bit more specific. So someone who smokes cigarettes a lot, cigarettes can cause advanced aging of the skin. Smoking cigarettes can cause advanced aging of the skin. Tanning outdoors, even tanning in tanning beds can age the skin because we know that sun ages the skin. So these things can accelerate the aging process. So doing things that kind of preserve the body, having a balanced diet, exercising, having a good skincare routine can also preserve the skin as well.
no that there's a lot to digest there. One of the things I want to bring up, because going back to the skincare routine, is that when it comes, you brought up kind of anti-aging, right? And
Hmm.
uh, the inner marketer in me goes, benefits. We always talk about benefits, and there's a lot of products out there for skincare, and people obviously want to retain their youthful look. I guess what is some general advice you'd have for someone that's a consumer in this market that has a lot of products that people are trying to sell you?
I mean, with so many ads all the time, right? We are constantly bombarded when we go onto the internet, when we go to social media, when we turn on the television. One of the things that, this is a tough question, but one thing that I tell patients, especially when they're trying new products, is to do something called a patch test.
Okay.
And it is when they just put the product underneath their chin for a couple of nights or a couple of days, and they just make sure that they're not reacting to it, right? They're not getting any rash, they're not getting any excessive dryness or sensitivity to that product. That's one, because people will try. multiple products. I have a lot of patients that love to try different products. And the first thing that when they come to see me and they bring out all their products and lay it out and they have some type of reaction, we don't know which product it is because they're using so many different products, is, try one product at a time. Usually products to see a difference, it takes at least a few months. I usually tell my patients at least 3 months to see any noticeable change. Um, and take pictures. Take pictures before you start using the product. And depending on the product, you can take pictures from every couple of weeks to once a month. And then kind of arrange your pictures to see if you see any difference. If the product is claiming that it helps with wrinkles, you have your baseline, you have it and once a month afterwards, and you can compare, you can look at your pictures and see if you notice any difference. Um, so that's one thing. Another thing is most dermatologists will recommend products that have studies behind them or research behind them because the companies that create these products show that they are vested in skincare. They want to show that they actually have results behind them.
Mm-hmm.
And there is a difference for products that go through that kind of rigorous testing because they are standing by their product. They're like, we've studied the skin and we've looked at the skin and we can say with certainty with this range that these products help. A lot of products over the counter may not have any testing behind it. Um, and they may claim things that may not be true um, for patients, but usually products with the research behind it do show some type of result.
Mm-hmm. No, I think that that's very practical, grounded advice, and I also want to hone in on the or emphasize too about the duration. You're saying like this isn't something that you're going to do a patch test in 3 days, right? There's going to be a certain level of commitment to kind of and documentation via pictures to kind of substantiate whether a product's right for you. Something the patch test made me think about this, Dr. K. At the start of our conversation, you talked about kind of how a dermatologist would see a wide variety of patients, right? Specifically, kind of noting like the age groups. Um, could you? And this is I'm putting a lot of weight on you, okay? Which is
Okay.
could you kind of maybe walk us through some of the various things that you may emphasize for a patient? Let's say if they were under your care for the full duration of their life, because you have a lot of different patients with different needs coming to you. Yeah, what's just some general things that you might focus on these various different age groups?
Well, so my patient population now, and I usually see teenagers till about, middle, late middle age, probably 60s. And but occasionally I'll have a baby, occasionally I'll have young children. For my young children that typically come and see me, it's usually for something that happens, like a birthmark that
Okay.
the parents may notice at birth, and their pediatrician said you should see a dermatologist, or eczema. Those are the two most common things that I see for infants. So at that point, we are usually documenting the birthmark. If it's benign, we note that, we measure it, we take photos. We do a lot of photography in dermatology, take photos and monitor it, make sure it's not changing as the child ages. For eczema, eczema is a rash that the body makes, and it can come at any point in life. But when it comes as an infant, we want to make sure that the parents are able to manage the eczema, keep the child comfortable, and also protect the child's skin barrier. So those are the two most common things I see
Mm-hmm.
for infants: birthmarks and eczema. Then with like young kids to preteens, it's usually things like warts. Warts are very common. They're ubiquitous in the environment. The virus is ubiquitous and they can be very common. There's a genetic component for warts too. Um, and or eczema as well. Those are the two most common things that I will see. And usually then I just kind of walk and molluscum. Molluscum is a cousin to the wart virus.
Okay.
And you can usually see a lesion on the kids. But a lot of times those will self-resolve on their own. We don't know how long it takes, but even if you don't do anything, for most kids, it's a virus that will eventually clear. The immune system will recognize it and clear it. And eczema, same thing as infants, it's just management, teaching the children how to manage their skin and avoiding things that can trigger the eczema. Um, then when I get to the teenage years, it's usually acne.
Mm-hmm.
Acne is very common, and even mole checks. So that's when a lot of parents will start saying, "Hey, we're moly and we're noticing that our child has a lot of moles," and that's a lot of teenagers will get their first skin check, especially if there's a family history of a lot of moles or beauty
Mm-hmm.
marks, people call them. And so we'll introduce them to what is a skin check, what to look for skin cancer, how to protect your skin against getting skin cancer, like wearing sunscreen, SPF 30 or more, avoiding tanning beds and seeking shade and safe sun. I talk about practicing safe sun exposure. And then when we get to the adult years, it can be anything. Literally, I see hair loss, psoriasis, acne, warts, lesion check. I mean, there's so many things that we can see on a regular basis. And then the cosmetic portion in the middle age, I have a lot of people, men, women, and um, LGBTQ others who are looking to preserve their aesthetic. They want to look a certain way. They want to preserve their look. They don't want to age quickly. And so we start talking about how to prevent aging of the skin, and things that you can do in the clinic and outside of the clinic to preserve the skin. And then in the older years is similar things to the middle age group, but then we're also focusing on preventing skin cancer, going over what to look for, and also checking in regularly if someone has a history of skin cancer.
Mm-hmm. No, that was a excellent walkthrough. I think there was a lot of great information that you revealed through that. Um, Dr. K, I want to give you just a little time here for you to address any misunderstandings about dermatology or skincare that you've experienced in your practice.
Oh, thank you for that. I mean, that's great. So, dermatologists are usually board certified. We are medical doctors. Some people
Mm-hmm.
get dermatologists confused with estheticians, with with estheticians are very commonly confused. They think that we may not be doctors, but most dermatologists go to medical school. All dermatologists go to medical school, and you go to medical school usually for at least 4 years. Dermatology is a very difficult field to get into, and so usually people are very, very bright. Um, and then we do an additional training after medical school. So if I dumb it down even more, after high school, there's usually 4 years of undergrad for most people, 4 years of medical school, and then 4 years of training. And the training is the residency, where we focus on the first year is usually general medicine. That's called the intern year, or general surgery. It can, or a mix of multiple things, but it's general medicine across the board. And then the next 3 years, you're focused solely on dermatology. So dermatology is a specialty. It is a type of specialized medicine. And like I said previously, in dermatology, it can be medical. So we talked about acne, psoriasis, skin checks, warts. It can be surgical. So dermatologists can cut out skin cancers, cut out benign lesions such as cysts, um, and many other things. So it can be surgical as well. And dermatologists can also do cosmetics. So a lot of times people think when they think of dermatology, if they know what a dermatologist is, they may think, oh, that dermatologists only do cosmetics, so Botox, fillers, lasers, and that couldn't be further from the truth. But it is in our purview, meaning that most dermatologists are trained on this as well. And additionally, dermatologists are doctors of the hair, skin, and nails. So it's not just the skin. We also focus on hair loss disorders or hair disorders and nail disorders. So that's another thing as well. Um, this is another basket of things that we specialize
Mm-hmm.
in outside of skin. And in dermatology, this is one of the things that attracted me to this field is that you can create your niche. So a dermatologist can do exclusively cosmetics and they can be a cosmetic dermatologist and they don't see medical or they don't do any surgeries. A dermatologist can do solely surgery. There's a specialized type of surgery in dermatology called Mohs surgery, where it is a sparing type of surgery that has a high efficacy clearance rate of skin cancers when it's used to treat skin cancers. And a dermatologist can focus, subspecialize in that field and do only surgery and not do any medical. And then a dermatologist can do only medical as well and not do any surgeries or cosmetics. So there is a wide range of things that you can do, and you can create your profession as a dermatologist. You can make it what you want it to be. There's some dermatologists that, because I can keep going on this all day, but there's some dermatologists that work in industry, meaning they work with pharmaceutical companies to help develop new medications and therapeutics for dermatology. And they may not see patients anymore. So research.
Mm-hmm.
Um, there's some dermatologists that are social media experts, and they may not see patients as much or little, and they educate the public. So there are a lot of different pathways that you can choose from dermatology. But the take home point is that we are medical doctors. We're certified by the board, the American Board of Dermatology, the ABD, um, and it it is a very dynamic field. Uh, Depending on who you see, like I said, dermatologists can focus on different things. So if you see a dermatologist that is a cosmetic dermatologist and they're not addressing your medical issue, that may be because
Yeah.
they don't focus on medical, right? So it's
Mm-hmm.
important to know who you're seeing in advance as well to make sure you're in the right place.
No, I appreciate you going over kind of the setting the education and like the board certification and then the delineation between those various different professions because I could see that that's a point of confusion. Um, and and on that note, as being someone that's gone through um, the education and had the practice that you've had, um, what are some maybe personal notions or notions of people that come into your office that you think may be misrepresented? And
I
what
don't
I mean by
understand.
that is just
No. Uh-huh.
uh, misunderstandings. Like some people that are conventional wisdoms or certain things that maybe that we think about skincare or skin that are simply just not true.
Um, I'm not sure, but I want to answer something else if that's okay.
Yeah, go for it.
So the other thing is because in dermatology, it can be very confusing. So we talked about dermatology as a specialty, but there are a lot of other physicians that may practice dermatology, but they're not dermatologists.
Okay.
So when you talk about conceptions and patients coming in, they may see someone that does, you can have a family medicine doctor that does Botox. Even dentists now do Botox. OBGYNs, obstetrics and gynecologists will do Botox. And not to say that they can't do it because you can. They are medical doctors, but if you're getting cosmetic things like Botox or fillers from a, a physician or non-physician, they're non-physician, so physician extenders that practice medicine as well, and specifically dermatology. I think it's important for patients to know who they're seeing, to know the credentials of the provider they're seeing, and to understand what those are. So that's one. Um, and there's a difference between physicians and physician extenders. And physician extenders include physician assistants and nurse practitioners. They are medical providers. They do not, however, go to medical school. They go to um, they go to nurse practitioner, physician assistant programs, and it is shorter. Usually, these programs are about 2 years. They do not do a residency, so they do not do a specialty focused in dermatology. They do have some fellowships or 1 year programs or a few months programs where patients can, I mean, these providers can get a little bit more hands-on, but they are very different than dermatologists. And I wanted to make that
Mm-hmm.
clear too because a lot of times, and I have physician extenders in my office, and they are amazing, and they make my life so much better in so many ways. But sometimes patients get confused and they call them doctors when they're not truly doctors.
No, I greatly appreciate furthering that distinction because um yeah, I mean I can easily see that myself as kind of I've gone through various different things in my care as a former college baseball player, and I know that some of the credentialing has come up with some of the care I've received, and so I think that that's a very important education piece, and I appreciate you highlighting that further because, um, again, especially when you're someone's rendering care, right? And I love that
Yes.
you bring up the cosmetics, right? I think that's an important one. You really want to be you want to have a level of confidence and competent and ensure that there's a level of competency there that you're comfortable with. So I do want to highlight on the cosmetics things. I guess you brought up some various different, I guess, patient scenarios that you may be involved with. I guess what advice do you have for someone that's maybe thinking of seeking out some kind of cosmetic treatment that maybe isn't related to like something that has I guess negatively impacting them like a rash or something. Maybe that's something more just cosmetic again.
Great, but I want to say one more thing. Okay, college athlete, because I ran track in college, so I know what it means to be a collegiate athlete. Woo woo. Um, in terms of cosmetic treatments, I usually tell my patients that they should ask for, before and afters, if they can, to
Mm-hmm.
see to see the work that a provider does. Also, ask a provider how they deal with complications because complications are inevitable.
Okay.
And that's why we have patients sign consent forms because even in the hands of the best provider, complications are inevitable. And this is another distinction between dermatologists and other providers that may not be equipped to handle complications. We are trained not only to do the procedures, but also to handle the complications that may occur after procedure.
Okay.
So that's a big distinction. So asking how a provider has dealt with a complication in the past, um, those are very important. Making sure that they feel comfortable because even if everything aligns, but something within you feel uncomfortable, I think it's important to kind of take notice of be self-reflective and take notice if a patient feels uncomfortable, then they should either speak up and explain why they feel uncomfortable or probably not do the procedure and get a second opinion.
No, that's I appreciate you saying that. You know, it's important for a professional such as yourself to make a statement like that because there's asymmetry, right? As a patient
Mhm.
going in to see a provider, right? You have a layer of ignorance, and I don't mean that in a negative way. So I think that that's very sound advice, especially the before and after and the complications thing. um I think that's really empowering to hear that. um Dr. K, I just want to give you kind of one last thing. I know we've talked about many different things. We kind of traveled all over, but um, what general advice do you have for people looking after their skin?
Our skin is our largest organ. And so I usually recommend that patients do skin checks, self skin checks. Just look at your skin once a month, once every other month. Look at your back, look at your toes, look at the bottom of your feet. Check your groin area. Make sure that you don't see any funny lesions or growths of concern, you know? But it's important to take care of our skin, to know what is on our skin and to know if something's abnormal, if it looks funny to you, to go get it checked out. Because a lot of times, most of the time, I think knowledge truly is power. And dermatologists are here to help people with their skin care, with their hair care, with their nail care as well. And we want to be your ally on your health journey.
That's excellent. Dr. K, how can
On your
people
skin health journey.
skin health journey? Dr. K, how can people learn more about you and the work you do?
I am based in Chicago, and my website has a lot of information on it. It is www.kaminskadermatology.com. I am so lucky to live in this wonderful city and to be a part of the Chicago community and to be a practicing dermatologist. I'm just eternally grateful to my staff, my patients, my family. It is an incredible and very satisfying career choice for me. So I'm available website and then we have an Instagram And I think we have a Facebook, but we do we definitely have Instagram and people can reach out to us. The best way to reach out to us is through our website or to give us a call. But thank you so much, Dylan. This has been great.
No, absolutely. Thank you for sharing your time and knowledge today.
And best of luck to you.
That wraps up our conversation with Dr. K. We talked about what people often get wrong about proper skincare, what researchers are still learning about skincare, and helpful approaches for building an effective skincare routine. Go to this episode's show notes to see any resources Dr. K mentioned during our episode. And lastly, subscribe to the Simple Questions podcast to get notified when our latest episodes are released. Thank you for listening, and remember to keep asking questions.